Hi folks, this is Dr. Herbert Lowenstein, and this week's video of the week is snow shoveling, okay? Now we know that today, Wednesday, December 9th, 2009, was the first significant snowfall of the year. In Ellenville, we got approximately 6 inches of wet, heavy snow. In some of the surrounding areas, such as Craigsmore, and then getting up into Sullivan County, they had closer to a foot of wet, heavy, nasty snow that needed to be pushed out of the way or shoveled off your walk or put someplace where it wouldn't be in our way. We typically see an uptick in our business during these days for 2 reasons. Number one, people go out there for the first time of the year and haven't properly prepared for snow shoveling, and they tend to injure themselves. So those folks that are pushing and shoving snow out of the way and overdo it tend to work their way into our office after a short period of time, sometimes the same day, sometimes a few days afterwards. The other issue we have with snow and ice days, and this is one that sometimes is considerably more serious, is that of motor vehicle accidents. The rate of motor vehicle accidents obviously increases on days such as this, and people tend to get injured. So I'm going to tell you, if you're out there driving on a nasty, snowy, icy day, if you don't have to drive, get off the roads, and if you do have to drive, just be very careful, proceed slowly, and don't push your luck. But getting back to snow shoveling, there's some good news and there's some bad news. The good news is about 15 minutes of snow shoveling a day counts as moderate physical activity, according to the 1996 Surgeon General's report with regard to physical activity and health. We should all aim for at least 30 minutes of moderate physical activity. Most days, brisk walking and dancing, aerobic exercises also count as physical activity during the cold weather. And I would implore each and every one of you out there to be involved in some form of physical activity on a regular basis. The bad news is that researchers have reported an increase in the number of fatal heart attacks among snow shovelers after heavy snowfalls. This rise is probably due to the demand that snow shoveling places on the body. It may cause demand for an increase in heart rate and blood pressure. One study determined that men's heart rates rose to levels higher than those normally recommended during aerobic exercises, which triggered some of these fatal and non-fatal events. Shoveling may and is actually a vigorous activity even for a healthy person. They did a study of North Dakota State University students and found that based on 15 minutes of shoveling activity, at 1/3 of the time, it went from a moderate physical activity to a vigorous physical activity. So even college-age students were pushing the envelope with this and putting greater demands upon their hearts. Shoveling obviously can be made more difficult by cold, inclement weather. We know that if you are cold, it puts extra strain on your body and the muscle tissue and your heart. So I'm going to tell you, if you're going to go out there and you're going to shovel, please dress appropriately for the situation. We don't need to be putting any extra stress on our systems than we need to. Those most at risk for a heart attack would include anybody who has a history of a heart attack, those with a history of heart disease, those with high blood pressure or high cholesterol, smokers, and those individuals who lead a sedentary lifestyle, who after months and months of sitting on their backsides decide to go out and shovel their walk, are greatly at risk with this. Not everyone who shovels snow is obviously going to have a heart attack, but most of us aren't, thank goodness. But I want you to consider the risks and be aware of what you're doing. Now, with regard to back safety and snow shoveling, it's like anything else. If you don't exercise regularly and you find yourself doing a vigorous activity, odds are you can hurt yourself and hurt yourself fairly seriously, which will result in a strained back, and you'll have to see someone like me for a week, 2 weeks, or more. We don't want you to do that. We want you to prepare properly. We want you to stretch. We want you to bend at your knees and properly use your back. Don't rely only upon your back muscles when it comes to pushing wet, heavy snow. You need to use your legs as well. If you've been active for months, as we said with sedentary activity, your risk factors are higher for straining your back, and use some common sense before shoveling snow. So in reviewing, what I would recommend is, if you are an inactive person and have a history of heart trouble, talk to your doctor before you shovel snow. It can be too vigorous for you. Avoid caffeine or nicotine stimulants. These may increase your heart rate, and it places extra stress on your heart. Drink plenty of water. Dehydration is just as big an issue in the cold winter months as it is in the summer. Dress in several layers to keep warm. We don't want to put any extra stress or strain on the body. Warm up your muscles for several minutes before shoveling by walking for a few minutes or marching in place. Stretch the muscles. Do whatever routine it is that it takes to keep you loose and flexible. Begin shoveling slowly, okay? Avoid placing sudden, heavy demands on your heart. Pace yourself. Take breaks as needed. It's all common sense. Protect your back from injury by lifting properly, by using your knees and your legs. Stand with your feet about hip width across, okay? Balance yourself and keep the shovel close to your body. Reaching far out will not help you. Avoid twisting movements if you can. And if you need to move the snow to one side, reposition yourself. So if you remember these few simple things, hopefully snow shoveling can be, if not a pleasant experience, one that you can utilize and get some exercise from, and one that can be done safely. We certainly don't want to hear of the stories of any one of our friends, family members, or patients having to go to the emergency room because they pushed themselves too far while shoveling snow. If you have any problems or any questions, you can contact me at 845-647-8866 or at info@lonstein.com. You can also reach us at our website, which would be www.lonstein.com. It's a brand new website. We just put it up in the last 2 weeks. I think you'll find it quite useful and educational. And if you have any issues with regard to your back or your health and you need to talk to me, I would implore you to contact me at your earliest possible convenience. Once again, this is Dr. Herbert Lonstein, and welcome to our weekly, thank you for coming to our weekly news topic that this week was on Show Sub.